Okay, parathyroid gland. So parathyroid we have four we have four glands on the corners. One on the top here, 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 and here on the top corner, on the four corners. And you cannot see it with ultrasound generally, but you can try. But I never saw it. I saw it like one time or something, and I thought it is like a nodule. But this is how it is. What is the? There are typically four glands located on the posterior surface of the thyroid from the back, and they are uh, two superior, two inferior, very small, like half centimeters, and the function secrete parathyroid hormone. So remember, we have the C cells in the thyroid gland was secreting calcitonin. C from thyroid, calcitonin. So calcitonin, its function to decrease the calcium, but the parathyroid is function to increase the calcium. Yes? Okay. So they act against each other to make balance for the calcium to be in the normal level. Normal level is something like 8.5 to 10.5. So it keeps the level within this level by if increase or decrease. So we have hyperthyroid, which is when you try to do the scanning, you have primary hyperthyroidism, which is going to be something in the structure of the thyroid itself, hyperplasia, carcinoma, or adenoma, or secondary that coming from other reasons like chronic renal failure, because chronic renal failure will cause decreased calcium. So it will need to increase parathyroid hormone to increase calcium. How to increase? You go in the bone, make resorption of the bone, take it from the bone, put it in the blood. That's how it works. And tertiary is after long standing from secondary hyperparathyroidism start having something called tertiary. So those we try to scan for or something before surgery or after surgery. Of course, we're gonna use the same thing. So by patient, you put belly under his patient's shoulder, and you use the linear probe at like 7 to 10, and we're gonna go. Uh, I'm seeing you cannot see it, but still you can try to go longitudinal and transverse. Normal gland is not visible. If you see it, it means it is this pathology. So normally you don't see it. Pathology, we have adenoma, which is most common cause of primary increase of parathyroid hormone, and it is gonna be like oval or bean shape, size 1 to 3 centimeter, little gonna be longer. You can see it, and it's gonna be has its own feeding artery. So you go for hyperplasia. The four glands will all of them will get secondary will be increased and secrete uh, parathyroid hormone. But they are smaller, less than 1 centimeter, smaller than the adenoma. They are multiple. And carcinoma, it is rare but aggressive. The same thing, we can say aggressive is going to be regular margin, it's going to be hypoechoic and increased vascularity. Ectopic adenomas, it can present in thymus gland or other parts of the body. We can use system, which is nuclear medicine, to locate it because we cannot see it with ultrasound, it's very hard, or use CT or MRI. Fine needle aspiration, if you need some big one, you can just do the same thing you can do under ultrasound and just suck it. This is the picture. I saw it like one time, two times. I never imagined this is parathyroid adenoma. I thought it is like cyst or something, and it looks like it's just normal structure of the thing. This is how it looks, parathyroid adenoma. Questions? You want to do some questions? Okay, let's go. Mhm. Yes. Parasite adenoma. This is the most common one. Yes. Yes. So this is on. Let's do salivary glands.